Does your health outcome depend on your age, your gender, or your race? Most people would like to think the answer is no, but studies now show there are disparities. Lauren Womesley wasn't always this active. For years, she suffered severe knee pain.
On a scale of 1 to 10, my pain level was an 8 to 9 every day.
But 3 doctors told her the same thing.
I was too young to have the surgery.
O'Connor says doctors often treat women like Lauren differently than men.
The term that I like to use is I'm not sure that a woman's voice is always heard as clearly.
One Canadian study found physicians who evaluated patients with moderate knee arthritis were 22 times more likely to recommend surgery for males. In another, women were up to 23% less likely to receive opioid pain meds in the ER.
Does the doctor think that her pain is as bad as the woman says it is?
Studies also show minorities are underrepresented in clinical trials. African Americans only account for 5% of participants, and Hispanics make up 1%.
Sometimes we're just uneducated on what's available.
Dr. Linda B. Kotler is trying to change that with Health Street, an organization that recruits minorities for clinical trials and other services.
It's important to have representation of all communities and populations in research so that their voice can be heard.
Daryl Pastor educates people in his community about the program.
Our job is to try to include as many folks in health research as we possibly can.
Lauren found a surgeon who did operate. She's active and glad she didn't take no for an answer.
I did a 5K 2 months after my surgery.
The most underrepresented groups in clinical studies, as we said, there are Hispanics, African Americans, Asians, women, and the elderly. Doctors say it's important to study these populations because certain diseases and conditions are more prevalent within different groups.